California healthcare
Yeah.
premiums earlier today. The bill was often advertised by its proponents as something that would lower healthcare premiums for everyone. But what we've seen is that some people, 25-year-old or 27-year-old purchasing health insurance, typical person in that situation, would actually see their health premium up by a large amount in some cases. What would you say to those people who are going to see their premiums go up?
Well, some people don't have health insurance, and they certainly will have their premiums go up because they don't have any health insurance now, so they don't have any premiums now. But for anyone that is a challenge, there are subsidies in the exchanges, and it's also about what you get for the money. In other words, people will be getting no lifetime or annual limits on their coverage, no discrimination because of a pre-existing medical condition. It has a whole array of quality that is in the legislation. But if you don't have health insurance and you don't qualify for a subsidy and you're mandated to have health insurance, yes, you'll have an increase. We're very sensitive to what it means for young people, especially young singles, and there are policies that people can get. I don't remember saying that everybody in the country would have a lower premium because everybody in the country doesn't have health insurance, so how could it be lower? But the fact is, the value of what you get for the cost that you pay is a reduction in cost to you. And if you don't have insurance, you're going to pay something that you didn't pay before, but if you can't afford it, you can have a subsidy on a sliding scale within the exchange. But for everybody, it is going to be, again, a liberation, a freedom. I mean, we dealt with the invincibles all along in all of this, and they were strong advocates, invincibles being young people who don't think they're ever going to be sick, all along, and their strong support for how we went forward so that they, again, could have the freedom to start a business, be entrepreneurial, do what they wanted to do in their lives, not constrained by the being sick. Or now, some of the examples that we heard would be somebody who thought she was invincible, getting diagnosed with breast cancer, and now telling us that she's going to spend the next 20 years monthly payments on her credit card to pay off her medical bills at the time. So will her premiums go up? Will a person like that, hopefully not diagnosed yet, paying something in, end up being better off? I think so. But you just see, I mean, be optimistic about it. It is a very, very exciting enterprise. And the other side has spent over did you see that report? $400 million mischaracterizing what is in the Affordable Care Bill, and still it's about where it was all along in terms of favorable, unfavorable. But I do believe that the more people see what it is in for them, if you're a young person, if you're a woman, if you're a person with children, if you're a senior, again, and if you're a small business, what this means for small businesses. It's a solution for the American people. It gets results for them, lowers cost. If there were no other reason to do the Affordable Care Act, if everybody loved their insurance and loved his or her insurers, you would still have to do it because the cost of it was unsustainable to individuals, to families, to small businesses, to corporate America, to state, local, and federal government budgets, unsustainable. And now you see the bending of the curve in terms of cost to the Medicare system, already extending for 2 more years the length of Medicare, and we have to do more, and the bill does do more. So costs were a very important part of it, and a main reason to do it, in addition to it being, as Senator Kennedy said, the unfinished business of our society. Health care is a right, not a privilege. Yes, sir.
Madam Leader, Republican leaders